Thank you, everybody, and I'm so glad that I'm able to come here and speak to you about the work that we are doing at the Feed the Future Innovation Laboratory for Collaborative Research on Nutrition. This is a USAID-funded effort, and it used to be called the Collaborative Research Support Program, CRISPS, and some of you agricultural scientists are probably familiar with the USAID CRISPs, and we're now all called the innovation laboratories, and we're all trying to wrap our heads around the new terminology. The Nutrition Innovation Lab essentially was established, this current version, in 2010, and it's hosted by Tufts University, funded by USAID. And our mandate is really to work around USAID programs that are implementing large-scale integrated programs around agriculture, nutrition, and health. So what I'm going to be talking today is going to sort of take a move away from what Martin is coming, but with the same principles around evaluation research. In our realm, what we're looking at, not just impact assessment, but also understanding effectiveness from the perspective of not just what works, testing a before and after scenario, but also how it works. So how does a program actually go from its inputs to its outputs, outcomes, and impact, if you will. So I'm going to try to be very concise in the period of time that I have, and I'll be happy to talk to anybody after the session. We're working in two countries, in Nepal and Uganda. We have two innovation labs, with one with a focus in Asia and one with a focus in Africa. I had to put this slide up just so that you are aware of the fact that we're actually a large team of institutions working together, including a lot of US institutions, as well as host country institutions. In Nepal, we work with the Institute of Medicine at Tribhuvan University, and in Uganda, we work with Makerere University. We also, because we are wrapped around programs, we actually have to work a lot with policymakers as well as development partners. And in country, in Uganda, we're working with FHI 360. And in Nepal, we work with Helen Keller and Save the Children. Now, before I go on to our research around these programs, I just want to describe briefly what we're looking at in terms of programs. This is the Community Connector program that is being implemented by FHI 360 in Uganda. And essentially, this program has different arms to it. And I'm just going to try to see if I can use this, and I hope everyone can see it. So what the Community Connector is, it's basically a program that is an integrated agriculture, livelihoods, and nutrition program, which aims to basically provide support in risk management, microcredit, savings, ag technologies and post-harvest technologies, and gender, along with providing ENA and EHA, service quality, and sectoral coordination. Now, there are some components of the Community Connector that are implemented directly by the organization, by the project itself, and in some components, they actually link up with other programs. So it's a program that is being implemented in 80,000 households across 15 districts of Uganda. And what our interest in is, coming as the Innovation Lab, is to understand how this program has an effect on income, health, and diet quality, and more importantly, how that relates to maternal and child nutrition. And the reason why we're looking at these outcomes is because the Feed the Future initiative really focuses on the outcomes of maternal and child health and nutrition. In the case of Nepal, what we're working with is a program called Swahara, which essentially translates to good nutrition. And what this is an integrated nutrition, agriculture, and health program, very similar but different from the Community Connector in Uganda. And what they focus on is essentially ag extension services, improving ag extension services, provision of training for home gardens and livestock management. And in some districts, they're actually providing the inputs. In some districts, they're actually providing only the training. So there's a variability in the implementation. They're also doing the support to the health service system and providing ENA, EHA, which for those of you who may not be aware, it's a training package of essential nutrition actions and essential health actions. They're also working on service quality improvements and sectoral coordination. And so this particular program, again, similar to Community Connector, is of our interest, as in how does this all relate from a perspective of diet quality towards maternal and child nutrition. In Nepal, however, we have another program that's of interest because this brings in a bigger, stronger agricultural component, which is just a recently awarded program called Feed the Future program, and it's called Kisan, which essentially means farmer in Hindi, and I believe in Nepali as well. What we're looking at is how the components of Swahara, because some of these components are going to be common with the Feed the Future Kisan program, how these are can be linked to the transfer of technologies like new seeds, irrigation, and rural finance, and how that relates into diet quantity and quality, and therefore maternal and child nutrition. So this is in a very quick nutshell as to what these programs that we are dealing with. They have similarities, but they also have huge differences. The other thing is these programs are often tailored to be implemented district by district or in cluster of districts. So the focus of the program is to really design itself in such a way that it addresses the needs of its target population. Now, this is very interesting when you actually have to start thinking about designing research around these programs. And so the first step that we all looked at the Innovation Lab is to see how we could take these program interventions and wrap an RCT around it. And I can tell you that we looked at it from high and low and left and right, and it's really, really not that easy to do. First of all, the number of treatments, given the variability in the implementation, not just in the package itself, you have 5 or 6 different treatments in the package, but the way the treatment is provided, whether in a single form or a combination form, made it not really amenable to an RCT design. And because we really want, when you use an RCT, to be able to have a certain number of treatment groups, and you have the confidence that you can actually detect differences in those treatment groups. The other reason why it becomes unamenable is really the resource and management scope, and RCTs can become very large and cumbersome, and they can be done as long as you know how you can do them. And so it's something that you really have to consider very carefully. There have been some fantastic RCTs that have been done. But unfortunately, in the case of the Innovation Lab research, what we realized was that given what we're looking at, it was going to be very hard to apply this design. The other reason why we had a hard time with this was basically the research design that we are trying to set up is around an existing program design. And for those of you who are programmers in this room, often there is a selection of districts that is based on criteria that have nothing to do with randomization. And so in the case from a researcher's angle, this is a purpose of selection process which does not then allow us to do any form of random allocation. There's another way you could actually try to apply a study which is more randomized is by seeing if you can randomly roll out the treatments or roll out in the purposely selected districts, but they can be done in a random fashion. However, that was not possible as well. The other reason that we felt that we really had to go away from this was there are coexisting multiple programs, and we really need to understand what's going on in the realm of the district within the context of these different programs. And finally, this is something that has come up in Patrick Webb's presentation yesterday, is that we just don't want to know what of the intervention we need to know how the intervention works. So it's not just about whether impact was achieved, but how that impact was achieved or not achieved. From a program evaluation perspective, I think that's one of the key areas that really, really needs to be addressed in this day and age. So what did we land up with? What we hope, and this is my colleagues at Hopkins always say, that this is probably not as good as an RCT, but this is really is going to be a reasonable design that is going to allow us to answer some of the questions. So what we have is an observational design in which we have randomized site selection with counterfactuals and a pre and post evaluation in both Nepal and Uganda. So that's the overall. We do have differences given the context we're working in are quite different. So in the case of Nepal, what we are setting up, and this is Hopkins in collaboration with the Institute of Medicine, is an observational cohort, also called as an annual panel survey, if you look at it from an epi versus economics perspective. And we are also setting up longitudinal sentinel sites, which will allow us to dig in and drive down deep on a quarterly basis in 3 specific sites in Nepal. In the case of Uganda, what we're doing is annual panels or a cohort which is implemented annually on the same households, and a quasi-experimental longitudinal birth cohort. Now, I've highlighted the two in red because these are the two that I'm going to actually just show a little bit more in detail, since we won't have the time to go through the other stuff. So the observational cohort or a surveillance system is being set up it's been set up in Nepal to assess the program response to agriculture, health, and nutrition programs in Nepal. And when I first started this presentation, I made note of the fact that we're looking at two programs, Suhara, which is being implemented in 25 districts of Nepal, and Feed the Future, which is in 20. And just as a reference, there are 75 districts in Nepal. So they seem to be having significant coverage when it comes to the country. What we also find, and this is not to go through this entire list here, but there are multiple other programs that are being implemented by different donors as well as the government of Nepal. We've got GAFSP, which is World Bank. We've got a multi-sectoral nutrition plan, which is implemented with the government of Nepal, and Sunaula Hazar Din, which is basically a sun or 1,000 days by the World Bank as well. So we've got like these sort of multiple programs that are occurring at the same time. And so what we realized was, rather than sticking ourselves to just Suhara sites and Feed the Future sites, it would be very interesting to expand the panel surveys and actually select sites randomly across Nepal so that they can represent all these programs. So in fact, what we're doing is an observational study across all these different programs in Nepal. And what we have is a sample size of 4,500 households. And this is just to show you how the selection of the households was conducted. So what you have in Nepal is three very distinct agroecologies. You have the mountains, and you have the hills, and the Terai. And what you see is the VDC, which is the smallest administrative unit in Nepal. And we've enumerated the mountains have much fewer VDCs than the hills and the Terai. And we've randomly selected 7 VDCs using systematic random sampling. And then you randomly select 3 VDCs per ward. So we have about 21 wards in the mountains, 21 wards in the hills, and then 21 wards in the Terai. And essentially, the idea is to collect data on the VDC and ward characteristics, as well as the household itself, which has married women who are under the age of 30 and women with children under the age of 5. In terms of the data domains, and I'm not going to go into this entire list here, but it really sort of reflects what is really needed when you want to understand agriculture and nutrition interventions and their effectiveness. So we have demographic and socioeconomic data, ag and food security data, gender roles and dynamics, diet and nutrition, and health. In terms of Uganda, we went in the direction of doing an observational birth cohort, which is going to estimate the coverage and intensity of exposure to a program within target populations at different life cycle stages. So what we'd like to do is enroll women in their second or their third trimester and follow them through their deliveries, and then when their kids turn 2 years of age. So we'd have data collection that will happen every quarter from the start or the middle of the pregnancy through till the infant is 2 years of age. We will be conducting the study in 3,600 households, and the sampling is in 12 sites where Community Connector is active at the sub-county level, and in those districts where it's active but it's not present at the sub-county, so there's a variability in that implementation. And then in sub-counties which are non-CC districts. So just to give you an idea of what we are thinking about in this observational birth cohort, this is height for age Z-score, which is the marker for stunting. We usually reflect stunting in the form of mean height for age Z-score. And what we're expecting, and this is what you usually see with kids, you have this dashed red line here, which is these kids are with no intervention here. They are likely to be in the non-CC district. And some intervention of CC is going to change the trajectory of the drop in height for age Z-score. So what you want in an intervention is to ensure that the kids stay, the height for age Z-score actually goes up and not down. So what we are looking at a situation is, what we're expecting is that we might see an effect where you don't see a positive change, but you're going to see less negative change in height for HC score in these kids. And what you're seeing here is some of the data domains for this study, and I can't find my, there it is. So we'll be looking at maternal health and nutrition, anemia prevalence. We'll be looking at birth weights at delivery. We'll be continuing with that realm of data collection on the mother, but we'll also be including agriculture, health, livelihood components. We are incorporating biomarkers. This is something which was highlighted yesterday, that linear growth is very, very slow to change. So it's really important to look at biomarkers that are likely to show a change more swiftly. We also are looking at aflatoxins, given the whole issue of food safety in Uganda and very high rates of mycotoxin contamination in the maize that is used for complementary feeding. So that's essentially what we are doing in terms of looking at the outcomes. But when I started this presentation, I mentioned of the fact that we really do want to understand how these outcomes are achieved. And since we are looking at these programs, what would be very important is to look at specific aspects of the program and how it functions. So this is the CGIAR program and its training cascade. So the way the program works is that it trains master trainers for nutrition education, and it uses what is called as a cascade approach, which incidentally is a common approach used in development for transfer of knowledge and behavior messages from the master trainer down to the mother, and these are the mother group members. So this is the cascade of training for essential nutrition actions, as well as for training for agricultural management practices and model farms. So what we would like to do is, this is the entire basis, or this is the framework of how CGIAR as a program expects to change behavior and improve practices that are going to lead to maternal and child nutrition outcomes. So what we are questioning, and this is going to be a separate study from all the outcomes research, is what was learned, was it effectively transmitted, what is the fidelity of the transmission, so what happens in the next level, does the message remain the same? Was there an effective integration, because these are training cascades that are dealing with both health training to all these levels, as well as agriculture training? And then did it actually get down further to the community? And finally, what did the mothers learn? So what we're hoping to do, and this is right now in process, we want to set up a study in which we're going to actually interview people across this entire cascade, including mother group members. But that being said, that's essentially trying to address the program itself, from what it's expecting to achieve as an outcome and how it achieves that outcome. A key area that really needs to be addressed is the realm that this program sits in. So in what I've spoken so far, we have addressed all the household characteristics, and we're going to collect all this outcome data that's going to allow us to understand if there was a change. But this is very interesting diagram which says that actually your program is sitting within the context of all the government and the public-private health system. There are other public services as other programs, and then of course you have the policies and programs at the government, the highest level, that are likely to affect what happens down here. So you could actually study the program itself, you can study the impact, you can look at its processes, but unless you understand the environment that it sits in and how that could impede or facilitate the implementation of the program, you're not going to get very far. So for that purpose, actually, what we're doing is, and this is a study that we've just finished one panel, we are collecting data at an institutional level, starting from the central, we're talking about Nepal over here, from the central level, so we've done national level interviews, down to the ward level, where we are going to every sector. There are about 6 sectors: health, agriculture, social development, labor, and we are interviewing them for understanding what is the potential for cross-sector coordination, what are the challenges and constraints at each of these levels for individuals or institutions to collaborate with each other, including with NGOs, and what is the capacity for these sectors to actually scale up these programs, because eventually that should be the aim. If this program shows the impact, it should be able to be scaled up. So essentially, the research on the coordinated delivery of services and inputs and ideas is going to allow us to correlate what's happening from the national down to the ward level to our outcome data, which is being collected at the community and the household level. So a lot more details of this are going to be presented in the policy session, including some of the preliminary results that we are seeing in our first panel survey in this area. So overall, what we are looking at as an innovation lab is a really wide range of activities that goes from looking at outcomes to looking at processes on how those outcomes were achieved, and then looking at the external factors that could be barriers or facilitators of those processes to achieve those outcomes. So we're really taking the concept, moving away from the concept of impact assessment to effectiveness evaluation. So with that, I'd like to just show you this particular slide, which is very interesting. This is for those people who are very interested in impact evaluation and design around impact evaluation, is the concept of the funnel of attrition. And it sort of caught my eye because we really are not paying attention sometimes when we are designing these studies in terms of who is our target and how many people are targeted versus how many actually you see the outcomes are achieved in. And the fact of the matter is we have to look at everything in between and understand why these things are happening and address them. So what we're hoping in the Innovation Lab is to be able to at least answer some of these questions. So thank you very much for listening to me, and happy to